Our 25,000 square foot simulation center was designed from scratch. There are three main areas of the simulation center: the virtual hospital, the virtual clinic, and the procedure labs. Our learners are medical students and resident physicians, pre-hospital care providers, practicing physicians, and entire healthcare teams. Our instructors set the stage on which the learner will practice decision-making, procedural skills, communication, and teamwork.
They start out for the first time not used to working with a fancy doll, but before you know it, they've transitioned into treating it like they would a real patient. And you know, their voice will crack, they'll break out in sweat, you can see that we're really challenging them to think as they would in a real clinical scenario.
Getting a hands-on experience, even if it isn't on a live person, it helps you go through the motions and remember all the steps that you need to do so you don't forget. Those things just make you more comfortable when you're seeing real patients.
We have case-based simulations using high-fidelity mannequins. They have all sorts of features that make them lifelike, but that's only a part of the equation. The other half is design of the case simulations and the effort that goes into creating realistic scenarios.
We've done multiple different scenarios: trauma, medicine, pediatrics.
Our simulation program is part medicine, part technology, and part theater.
We try to challenge the groups in a variety of different ways. We put them into high-stress simulated conditions. We'll often use low light, smoke-filled areas, loud noises, and really try to create some of that situational chaos that often is at the scene of a mass casualty incident.
All case simulations are followed by debriefing sessions conducted by trained faculty. During these sessions is where most of the learning occurs.
One thing that I learned about WMed was the fact that this is one of the few medical schools that actually provides the opportunity to get some clinical experience early on. And the standardized patients are a very integral part of that.
The standardized patient program is hiring people to be patients so that they can portray and act like a patient, plus they're also specifically trained on communication skills and feedback.
As a standardized patient, my goal is to help future healthcare professionals understand and realize how their verbal and nonverbal behavior can influence the health outcomes of their patients.
What we're trying to do is, they've got the book smarts and they've got the great attitude, but what we want to do is give them all the experiences that they're going to have in a real hospital.
Simulation accelerates learning. It helps identify weaknesses and deficiencies. It fills in experience gaps. It allows learners to practice skills, to gain confidence, and to prepare themselves for patient care later.
When you get a patient in the real world and you think, I don't know what to do, you just kind of go back to what you learned and you've practiced so many times before, and it just becomes second nature to you.
As a medical educator, that's one of the coolest things, is to be able to get that kind of feedback that you know, what we're teaching in the simulation center or out in the field in simulation is able to be applied to real patients.
It's not just about the patient exposure, it's not just about administering drugs, it's not just about taking vital signs. It's a combination of all of this, and by making sure that we can do all of the mandatory activities that you really need in order to treat the patient, you're making those just such a natural habit that at the end all that's really left for you to focus on is the patient. And that's really what medicine comes back to.